Hello and welcome to the most hated show in the black corner of YouTube. I am your host, the whiteologist, Mr. Blows Your Minds, and this is Black Minds News Report. Black Minds News is to report, articulate, transmit, communicate, insinuate, develop, investigate, decode, unveil, spread the news, whether it's by news, video, website, or quotes from publications. As I articulate this information, I tell the creator of the universe be here, heart, soul, mind, and spirit. Because why? The truth don't need no partner. As a descendant of the greatest people who created this land that you call the United States, we, the BADOS, Black American descendant of slaves, we, the today's children, offspring, and present generation, we give honor to our ancestors. You know what the motto of my show is? I'm never gonna tell you what I heard. I'm only gonna tell you what I know. Today's date is April 3rd, 2020. Did you hear? Looks like the FDA has come out talking about some restrictions due to the simple fact that people are donating blood during the coronavirus. So some people, based on the restrictions, are being adhered not, and they've changed the restriction period. So some of them are upset about it, but this particular story here, according to what was laid out, it seems like people are kind of like those who are hoarding, right? Taking advantage of a situation. Now again, this story will not be about talking about anybody in particular. This is what the story is, but it seems that you're not telling everything, the reason why these restrictions might be there, and the true purpose of why they decide to come out and change it due to what's being known as the coronavirus pandemic. So stay tuned as Black Minds News delve into this topic. Hey, how's y'all doing, everybody? Again, this is your host, Mr. Blows Your Minds, and welcome to Black Minds News Report. First and foremost, I want to say what's good to my fam, my subscribers, old, and I guess maybe I'll be getting some new ones. I have been gone for a little bit, y'all. I know I'm trying to get back in. They're going to be doing these one-hitters. You know, we normally do a theme over here, but to get myself and get my feet wet back into it, I'll be doing these one-hitters until I decide to get back into it full 2 feet, right? So anyway, I want to say what's good to y'all and everybody and all those who were sending me messages to say they haven't heard my voice. I've been trying to get in contact with you. I read your message. I didn't reply, not because of me just trying not to reply, but I knew I was going to make this day come. So again, eventually we would talk. So what's good to you as well. Passerbys, if you happen to pass by, this is the most hated show on the black corner of YouTube. This is called The Corner That the Builders Reject. Let me say that again. This is called The Corner That the Builders Reject. Again, you can go down my aisle. We always got a grand opening over there. You can go down the aisle, see some things that might, make you feel some kind of way. If it should make you feel some kind of way, remember that the motto of my show is the truth. Don't need no partner, right? So let me go ahead and get up into this part here. Let me go ahead and do this, right? Because, I think it's some information that just needed to be known. For the simple fact that, sometimes something slid up on the radar due to the simple fact that, people are feeling anxieties and fears. And there's a lot of people who find out that being by themselves, they don't like themselves, right? You don't like to find out really don't like yourself, right? You by yourself and all you got to do is try to figure out how to do some things. So there's people doing videos, kind of funny and stuff like that. But anyway, I seen this article and I decided I was going to go ahead and display it to my audience. And we ready to do that, sir? We ready? All right, so let's go ahead and let's do this, and then I'll be back afterwards. Check this out. FDA eases restrictions on gay blood donors amid urgent need. You know I'm going to say that again. FDA eases restrictions on gay blood donors amid urgent need. The decision to reduce the donation deferral period for men who have sex with men comes as blood drives are being canceled due to the COVID-19 pandemic. This story is coming out of the NBC News, April 2nd, 2020, written by Tom Fitzsimmons, and this is how it reads. Amid what is calling an urgent need for blood, the Food and Drug Administration revised its blood donor guidelines on Thursday, significantly easing the restrictions on men who have sex with men. The new guideline reduced the donation deferral period for sexually active gay and bisexual men for 12 months to 3, meaning these otherwise healthy men will now have to abstain from same-sex activity for 90 days before they are eligible to donate blood. Other 12-month deferral periods have also been shortened under the new guidelines, including those for people who have traveled to areas with certain endemic diseases, those who have engaged in injection drug use, and people who have participated in commercial sex work. Restrictions on gay blood donors date to 1983, during the height of the AIDS crisis, when the federal government instituted a lifetime ban on blood donations by any man who had ever had sex with another man. The rule, intended to keep HIV out of the blood supply, was replaced in 2015 with the year-long abstinence requirement. Prior to the release on Thursday's updated guidelines, restriction on blood donation from gay and bisexual men, who represent about 70% of all new HIV infections in the United States, had come under increased scrutiny from lawmakers and LGBTQ advocates, particularly after coronavirus fears forced the cancellation of many in-person blood drives. In a Thursday call from reporters, Surgeon General Jerome Adams said it's critically important that people living with HIV do not give blood, but said the new changes better reflect the time it takes to detect HIV in blood after certain risky behaviors. Adams also touted changes to the donor's requirement for people who have recently gotten tattoos or piercings, hoping they too would grow the eligible blood donor pool. These changes are based on the best science that we have today regarding the time that it takes to test positive for HIV. Adams told reporters, saying the updated guidance would reduce stigma and encourage more people to do the right thing: donate blood. As NBC News reported on Wednesday, at least one gay man who tried to donate blood to give to COVID-19 plasma antibodies was told that he was disqualified for 12 months because he takes Truvada to remain HIV negative. On Thursday's call, the FDA, Dr. Peter Marks, said that each blood center can decide how long blood donors must stop taking certain medications, like Truvada, before coming in to donate. Each blood center might be a little bit different, Mark said. For people who recover from COVID-19 and seek to donate plasma for experimental antibody treatments, Mark says they should wait for 2 weeks after all symptoms have resolved and will likely need to test negative for active coronavirus prior to donating blood. Those who wait 4 weeks after the resolution of COVID-19 symptoms may not need an additional test. In either case, Mark says they need documentation of their COVID-19 status. U.S. Senator Tammy Baldwin, Democratic Wisconsin, who led the effort by a group of 15 senators to ease the gay donor restrictions, called the FDA's new guidelines an important step, but said there's still more work to be done. The administration needs to change their blood donation policies to be based on individual risks so that all healthy gay and bisexual men are able to donate. She said in a statement shared with NBC News, "This is more important than ever as we continue working to address the COVID-19 pandemic and help save lives." The Human Rights Campaign, the country's largest LGBTQ advocacy group, issued a similar statement. While this change by the FDA is a step in the right direction, it still bases itself in bias rather than science. The organization president, Alfonso David, stated, "Creating policies based on identity as opposed to risk is irrational, and given the current COVID-19 crisis, it is more critical than ever to prioritize science and facts over fear and bias."
And with many blood drives canceled, the FDA says that there's an urgent need for blood. So the agency is now easing restrictions on gay blood donors. Today, the FDA changed the so-called deferral period from 12 months down to 3 months. Now, that means potential male donors would have to abstain from same-sex intercourse for 90 days before donating. And that same rule applies for female donors who had sex with a sexually active gay man. Health experts say that blood donations can be done safely even during a pandemic.
Through a health screening, all of the surfaces are wiped down, trying to avoid a public health crisis within a crisis.
The FDA also eased restrictions for people who got a tattoo or a piercing at least 3 months ago.
All right, so we are back, right? All right, you didn't get that in time, right? Okay. Well, I'm going to dock you for that one. So anyway, right? So, see that the FDA has eased restrictions on gay blood donors amid urgent need, right? Now think about that. It says urgent need. Now, according to the way that title is showing or stating, you would think that this urgent need, based on right now, we're talking about a pandemic, right? So blood is being needed right now. And what association is the blood to the coronavirus should be ding in your head, right? That should be something in your head. Be like, okay, damn, what does blood and the coronavirus got to do with this, right? They're talking about flu symptoms and headaches and pneumonia. What the blood got to do with it, right? So anyway, we're going to get to that, right? So again, they're saying that the FDA is going to revise the blood donor guidelines, right? And they're going to do some easing in the restrictions. And it looks like according to this article, that the person who wrote this is Tim Fitzsimmons, that they're targeting men who have sex with men, right? Men who lie with men, right? And that they're going to defer the period. The men who are classified in this particular group here, which we're going to say the LGBT group, who are sexually active gay and bisexual men, I guess the restriction or the requirements used to be 12 months, is going to be now lessened to 3 months, right? So about 90 days, right? And it takes about 90 days to be eligible to donate the blood from men who fall under the category of gay and bisexual, right? And then it also talked about it was including those who travel to areas with certain endemic diseases. So I guess right now, being in the United States, having a pandemic, right, is bigger than an endemic, right? And so you coming from a country that has an endemic, you might not qualify to donate blood. Those who are intravenous in I guess you say drug uses, they say injecting drug use. Now, does that also just only mean the junkie? Or could that be anybody who might be using, let's say, people who take shots because they have high blood. I forgot what they use that for. Those what I'm talking about, right? So anyway, it slipped my mind right now. But anyway, you know what I'm talking about, right? So those who take insulin shot, that's what I'm talking about. For insulin, right? Would they be considered in the injection drug use, right? Or they just talking about the dirty needle ones, right? They also talked about people who participated in commercial sex work. Now, like commercial, now again, that must be the ones that they're getting tax money from. But if you was doing it and they didn't get the tax, that don't count. You can still do that according to the way they wrote it. So I guess commercial would make it seem like, well, anybody who's actually doing it on the, on toot toot, hey, beep beep side, you already know you burned up, right? So I guess they don't even come in and give it no blood. But for those who try to stay in the safe confines of the Bunny Ranch and going to your neighborhood strip joint, maybe throwing a couple dollars on the side, trying to get you a personal lap dance, right? You may fall under the restrictions. We have to check your blood, right? Then they talk about the fact that how this restriction came into place was in 1983. It started when they had the AIDS crisis, and that the federal government had a lifetime ban on if a man ever had sex with a man. They ain't say sexually active, classify oneself as gay. They said if you ever had sex with a man, you could not donate your blood. Well, it looks like in 2015, that law, or that I guess it could have been a law, was restricted or replaced with, instead of them saying a lifetime ban, they say, well, a year long of abstinence requirement. Now again, people lie, right? We ain't gonna sit there like people lie all the damn time, right? So, matter of fact, fellas might be hearing me again. This is no shot at the women, but sometimes you have. Wow, I can't say today because today might be a little bit different because of the way the game is played today. But let's just say you go back a little bit again, right? You see somebody you like, try to holler at them, you know what I'm saying? They're going to put you through the rigmarole. They may get a little timeline. I ain't going to give him none. You're going to drag it out for a period of time. My man, he's sweating it out, you know what I'm saying? Trying to be, Mr. Chivalry. Put his leg, how they put the coat over the water, open all the doors, you know what I'm saying? Wipe a little ketchup off your mouth, you know what I'm saying? You look good, right? Do the chivalry thing, right? And, all in hoping that it all pays off. But she's saying, I don't get down on the first night, right? So, to make her look respectable, right? It put you through that whole rigmarole. Then you finally get to do the do, and then it done took you a little bit of time. But, a lot of fellas, we never really kind of critique you if it happened on the first night. Maybe my game was just that tight, right? Maybe the game was just that tight. He just wooed you down. Don't necessarily mean that we look at you any different. You understand? But I think that's the psychosis that, again, they try to put in there. But again, they're just saying, the reason why I'm saying is because it's saying abstinence, meaning people lie. Come to find out that you try to make a housewife, know the old saying, right? Try to make a housewife out of a, right? Some of us done fell through that. We know how that go, right? You didn't know who they was, but they played the game to make it seem like they was hard to get. Gonna find out, you know what I'm saying, it was easy. Now I go both ways now, so don't think I'm just saying that just on y'all. I'm just saying in general. But, you saying that the law that was back in, that the federal government had banned that if you ever had sex with a man, got replaced in 2015 with a year-long abstinence requirement. Now, because somebody said the abstinence for 12 years is the reason why I made that, little analogy in there. I guess I can't even say that, but a little story to that, right? People lie and say, I ain't doing nothing. How do one know? It's kind of like not too long ago, some months back, when people were appalled when they heard that T.I. took his daughter to go get tested or to see if she was still a virgin. Now, if you a virgin, I'm pretty sure there's a way to tell to see if, it ain't been popped, right? I don't know how you tell on a boy, but for a female, I guess that's the way you can check. But how do you take somebody's word who comes in and tell you, well, I've been absent, I ain't had no sex in 12 years. Women, dudes run game like that on you sometimes. Ain't had sex, would you just get up out of jail, right? So, unless he say that, right? He did, I ain't had a relationship, I just work all the time, with the woo, right? And you like, okay, he nice. Out here pumping everything he can get, But that was back in the old days. But anyway, so they replaced that with a year-long abstinence that you had to require, that you had to somehow just state that. Then according to the article, it talks about that 70% of all the new HIV infections come from gay and bisexual men. According to this article, 70% of all new HIV infections come from gay and bisexual men. 70%. The majority of all the new cases today, according to what this article was stating, that they're coming from gay and bisexual men. So with that being stated, that's a high number. That's more than half. That's 3/4, more than 3/4, right? So they said based on the corona fears, a lot of blood drives have been canceled, right? And I would assume the reason why they're saying that is because they're talking about gay, right? So let's say that the LGBT group decide that they want to do some humanity work and thinking about donating blood because they feel that, people need blood. Just like I did a story not too long ago, those who had watched that did the story based on gay men were donating their sperm to the sperm banks, right? Even though they know their lifestyle can't produce their own children in the way that their lifestyle is, but will donate for the cause of their race to further produce children that a lot of them are having a hard time having, right? And you have to go back and see that video from what I had talked about in there. So we see that the Surgeon General, Jerome Adams, he said it was critically important, right? He quoted that. Critically important that people living with HIV do not give blood, right? Because then what happens is the blood gets contaminated and now you're infecting other people and now they have it based on the fact of blood transfusions or getting blood work. And so he said these new changes give time to detect HIV in blood. After, and then it said after risky behaviors. Now, again, to each his own. What you do as to your sexual behaviors between you and that other significant and other person, that is y'all business. That ain't my business. I do what I do, you do what you do. Sound like Fred Sanford. Remember what Lamont Cato when he was on his African thing? He said, you are you and I, and that's why I love your pops, right? Remember that? Right? So that's what that is, right? So you do you, I do me, right? But here it is, in the way that they're writing and what they're stating, it's kind of subliminal what they're saying. They're kind of saying that the lifestyle has a dirty part to it, right? Yes, we're not trying to say that, okay, the way that everything is today, people try to say, well, it's acceptable. Yes. But see, now that everything is becoming a crisis and it's life and death, people now, especially in these positions, not because of what one feels and not one is protesting and what one feels, but they had to go on what is considered to be medically. And they say there are precautionary measures that has to be taken in order to make safety for everyone, especially if you're going to try to participate in trying to, let's say, donate your blood and parts and so forth, that there's restrictions and there must be, we have to put it through a procedure so that we can detect to make sure that the safety of not just, yourself, but others as well. And so it said risky behaviors. What do they mean by risky behaviors? Are they saying that lifestyle is risky behavior? Is that medically known? Because they argued in this article, right? You heard them try to argue the fact and say that, that's not fact, right? That that's really not fact about what they're stating from the FDA. They said that is more about being biased and racist towards people who are considered to be in the LGBTQ group. But we know those who've been around that remember when it was the DSMV back in the 1970s, I think it was the late 70s, that had classified at one time as the lifestyle of the LGBT was considered to have some psychological issues and problems, that it was under a psychosis of the mind. But as time went on, just like in 1983, the federal government had said that if you man slept with man that can't ever donate, then somewhere later on, it's 2015, because from 83 to 2015, a lot done changed as into legislations. And now they say, well, you just say you was absent for a year and then you had no sex for a whole year, then your blood should be okay. Really? I guess it could be. I guess it could be. Okay, all right. But anyway, right? So with that being said, the people saying, no, stick to science. Does science say that now? Again, anybody can advocate for anything. It's kind of like having an argument. I can find things to support my argument, but does that necessarily mean that it's fact or it's true? Or can I make it be true because of what I present? And depending on what side of the argument you on, one could be in opposition to it and show things. So then you just have both sides presenting both arguments. But when the machine itself has an agenda, then the machine wins its argument, whether it's right or wrong. Let me say that again. Two people can have a disagreement about a situation, and both can present their evidence to support their stance. But it is like a courtroom with a judge who decides who won the case. But if the machine, which would be the judge, we've seen who jumped in, LGBT and lawmakers, decided to support, then the machine will win whether the facts support it or not, is what I'm saying, right? And so it talks about these new changes will help them to detect, right? And so they also included people who recently just got tattoos, people who just got piercings. They have to wait too. Now, a lot of people do even think about that, especially in this day and time, going to get, because you know, a lot of people done tatted, you tatted up. Shit, grandma tatted up, right? Grandpa tatted up, right? But when you're getting them tattoos, were you even thinking about the transferring when you was getting all that done? Or was it just the excitement of getting the tattoo and not thinking that, I'm putting ink into my body that's going to be somewhat permanent, right? And then the needles, and I got to be trusting, there's a lot of things to be considering if one was to do that. But here it is, the FDA is saying that that in itself is risky too. But I don't know if a lot of people put forethought into that when they're doing that, right? And so it goes on and says that there was one gay man, they said, tried to give blood that disqualified from using. He was disqualified because him being gay, I guess, is not the reason why they were disqualifying him. They were disqualifying him because he was using the drug called Truvada. Now, Truvada is what keeps, they say, HIV negative, right? Another name that you can call that, I think it's called emtricitabine or tenofovir, right? And they sold, that's what the name of the brand is under, Truvada. And it's a medication used to treat and prevent HIV and AIDS. It is a fixed dose combination of two antiretroviral medications, right? Tenofovir and disoproxil, and emtricitabine or bine for treatment is used either along or together with other antiretroviral medications. For prevention before exposures and those who are at high risk, it is recommended with safe sex practices, does not cure HIV and AIDS, and it is taken by the mouth. So this person here, I guess, disclosed the fact that they was taking this emtricitabine tenofovir, known as Truvada, right? Yeah, I probably could have went in medical school, right? I was going to say that shit, right? But anyway, so that is what this person, now they said one, right? They had to have one because otherwise it would have been 100%. So one person, which means there might be others who might get through because if the one doesn't disclose, because that's another thing too. Not every person who fit under the LGBT, sometimes they don't fit under the characterization that many people may have of how people perceive them. May come, looking the pot that you can't, it's undetectable. So if a person like that donates and never disclosed that, then did it not sneak through, right? Didn't get through like that, right? So you depending on the honesty of the people, right? So the question becomes, and I know it should have came because it came in my head when I was doing this story. Why are they talking about blood when we talking about coronavirus, right? Like, okay, so why would he make this story talking about that? Well, the reason why is because the blood centers are beginning to collecting coronavirus antibodies from COVID-19 survivors. I'm going to say that again. What this article talked about, what the one that I just originally didn't want to disclose, and trying again, you got to ask the reason, okay, why didn't you mention this part? Why aren't you mentioning the fact that they're collecting blood from the coronavirus survivors, trying to get the antibodies out of their blood so that they can do what? Come up with either a vaccination, right? But you are focusing on about gay. See? That's kind of being a little bit deceiving. You're not being forthright. You're trying to have your own agenda because you're so thinking that everybody is against you, and you try to still find a way when really it was not about the gay. It was about if you should be gay and have the COVID-19 and you are a survivor, then them getting your blood, right? That's what they're talking about, because what they're saying is blood donation centers across the United States are ramping up in efforts to collect plasma from people who have recovered from the COVID-19. Now, it's in hope that they can save lives of other infected people with the pandemic disease, okay? And what they're saying is that transfusion medicine and cellular therapies, which is dozen blood community centers nationwide. The key source was century-old treatment known as convalescent plasma therapy, right? That is what they're trying to do. They're going to go with an old method that they talk about called convalescent plasma therapy. And this is where the treatment is used for the blood products taken from people who have recovered from a viral infection. Then they're going to inject them into those who are still suffering. This experiment practice was used during the devastation of the 1918 flu. Now, why didn't they, who were writing that, this Tim Fitzsimmons, you're focusing more about you and your group than what the real underlying truth to the story is about. It's not about being gay. It's not about them ostracizing you as being gay. What they're trying to say is we're trying to find those people who have recovered. And I don't know if you're saying that the people who are gay, bisexual, according to the FDA, who might come back positive with COVID-19, are they giving their bloods in donation to help try to get the plasma that can be reused to try to help somebody who is sick? Because whatever's in you that helped you, rid yourself of your COVID-19, they're going to use the antibodies in you and put it into a sick person. Right? Now, that's what they're talking about here. That's what they're talking about. But you see how somebody has to have their own personal agenda and wonder why when black people, when we talk about our own self-preservation, about how we need to focus about us and quit talking about holding everybody's damn hand, because see, people got their own agenda. And even those who might be black, who are gay, you put your sexual preference over your race, and it gets skewed. And then you allow other people who be really the head of that machine. You're just intricate parts in it. You're a cog, spring, sprocket, but they are the machine that makes it operate. And when most of the agenda that's being used is towards what they're looking, and you know what I'm saying, you could be expendable if you don't follow suit, right? And then what they do is then they feel like, oh, we're getting the worse. We're gay and we're black. Well, you was black first. So that already had covered that. You didn't need to even use that. You didn't need to use that. You was black anyway. But we know sometimes people jump off there trying to find somewhere else to get in. But anyway, that's what it is. But I just thought that it was kind of slickly trying to be talking about making it about gay, when really it wasn't about being gay. It's about the blood. It's about using the plasma. It's using to try to take the antibodies out of the plasma so that you could actually help somebody else who is having or dying from the symptoms of COVID-19. But you want to focus more primarily about being you as gay. See? Let's see how that works. So even like they talk about those who was hoarding the tissue and the hand sanitizer, it was looking for an opportunity to get, in that case, they wanted to make money. This case here, you want to still make a statement about you during a crisis epidemic when it ain't about you. It's about dealing with the pandemic right now. It's about dealing with the COVID and those who be affected by it. Not about your sexual preference. And ain't nobody ostracizing because legislation now you can marry. It's just one thing after another. But those people who've been ostracized, who are still black, are still dealing with it. And no one is talking about none of that. Right? So anyway, y'all tell me what you think. Again, this is Black Minds News. Want to bring this to you. Let you hear a little bit about it. Just in case you might have seen it, just in case you didn't. There's two sides to that. Because you had to ask yourself, what did blood have to do with coronavirus? But see how they can take something and try to, attach it to make it about an agenda for themselves? When it wasn't about that. It was all about the antibodies in the plasma to try to help other people who they're trying to come up with, because it's the same way they did with the 1918 flu. They took that, and that was helping the people to use the plasma therapy. But that ain't what he was really want to focus on. He wanted to focus more about them and their group. And that's the selfishness that some people got, right? Again, in some hard times, you get to find out what some people really and what they truly about. So again, like, comment, share, subscribe, dislike. It's up to you. You know what I'm saying? We EEOC over here. We don't block. We don't do none of that. You're entitled to your opinion just like we over here at Black Mind News. We do what we do. So we ready to do that, sir? Let's go ahead and get cranked that up. Let's get it going. You ready? All right, go ahead, did it. All right. We got another one off, right? So I want to thank each and every one of you clicking on the video. Black Minds News, kindly tip our hat off to you. Thank you for your listening ear. And stay tuned for our next one. Again, when you see your brother, greet your brother. What's good, brother? What's good, brother? See your sister. What's good, sister? What's good, brother? If you can't do that much, at least give the universal nod. You're not a universal nod. You see me? What up, bro? What up, right? Right? Some of us got allies, right? Especially in this time of this pandemic, say things set up. You're going to have to ask your allies some questions. Since shit is hot, and shit can get worse, you going to still be in the frying pan? You're going to get up out of here and say, I just can't, right? Ask your allies another question. Ask them, have they ever heard of John Brown? Ask them, is John Brown real or was he a fictional character? Because I ain't never, ever seen a movie about the man John Brown. Like John Brown was the worst white man that was ever made and lived in the United States. A white man who took his own sons and went after the fight for the inalienable rights of black people is not worthy of mentioning. So again, this is Black Minds News. Peace, love, and to the next show, y'all. To the next show.